likely that we would be among the first states to find the variant. And so it's important that we share this news with you as soon as we have it. And indeed, it is literally hours old. The detection of the Omicron variant in Minnesota certainly can feel concerning, and we understand that. With every new variant, and we've had several of them, there are quite logical questions and wonders about what this means. While this is clearly something to take seriously, Omicron's development around the world, it is not a reason for panic. As with the other new variants that we have managed, we're at a stage where there is still a lot we need to learn about Omicron. There's much more we don't know yet at this point than what we do know, such as how severe the disease is with Omicron, how transmissible it is. And we and our colleagues around the nation and the world are continuing our surveillance for this variant so that we can learn more as quickly as possible. And we're in very, very close contact with CDC and other public health partners across the nation to share information among ourselves. And our scientists are also very hard at work and quickly working to study the degree to which existing vaccines and therapies protect against Omicron. And as you've heard from some of our national leaders, we do expect that to be a matter of weeks before those data begin to be available to us. But what we do know already, without waiting for the research, is how to slow the spread of COVID-19. And the recent emergence of the Omicron variant further emphasizes the importance of continued efforts by all Minnesotans to limit the spread of COVID-19 in any form, as we talked about yesterday. The most important thing we can do right now is stay on offense and use the tools that we have available to make it as hard as we can for this virus to spread in any form. In addition to vaccination and boosters, we can slow the spread of this variant and all COVID-19 variants by using the layered prevention methods of wearing masks, staying home when sick, and getting tested when appropriate. While we are literally still in the early hours of conducting our investigation, we can share a little more about the case in Minnesota. The person with the Omicron variant is an adult male, a resident of Hennepin County, and had been vaccinated. The person developed mild symptoms on November 22nd and sought COVID-19 testing on November 24th. The person's symptoms have resolved. The person spoke with MDH case investigators and reported traveling to New York City and attending the Anime New York City 2021 convention at the Javits Center, which was held from November 19th to the 21st. The Minnesota case was advised to isolate from others and is doing so. Minnesota epidemiologists will continue to investigate in collaboration with New York City public health officials and the U.S. Centers for Disease Control and Prevention. I just want to reinforce again, now is especially the time for everyone 5 and older to get vaccinated, for everyone 18 and older to get their booster when they're due, for everyone who has symptoms or has been exposed to get tested and to take the appropriate action with the results of those tests. Also, for everyone to take additional steps by wearing well-fitting masks in indoor public settings and crowded outdoor settings. That is all of us, vaccinated or unvaccinated, everywhere in the state, given the high levels of viral transmission that we have all across Minnesota. Another core step is to stay home if you are sick, no matter if it feels like just a cold, to help prevent the transmission of viruses during this particular season. Washing our hands frequently, staying away from crowded indoor areas, improving ventilation in our homes, our workplaces, our schools, and taking extra care to avoid exposure to the virus if you yourself have underlying medical conditions or if you live with someone or plan to be with someone who you know has underlying medical conditions. We have worked hard in Minnesota to make vaccination and testing widely available and convenient for Minnesotans. And you can visit our MDH website for more information on vaccination and testing locations and other relevant facts about COVID-19. With that, our main objective here this morning is to just try to answer as many of your questions as we can, even though this is a very new situation in its early hours. but we want to be available to you for questions. So I will stop there and turn it back to Mike.
Thank you, Commissioner. As we open it up for questions, I'll note that we have a large number of reporters on today's call. To make sure we can get to as many of your questions as possible, please limit your questions to one primary and one follow-up. With that, operator, we're ready to take questions.
Sir, as a reminder again, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Again, if you would like to ask a question, press *1 on your telephone keypad. The first question comes from the line of Jeremy Olson from Star Tribune. Your line is open.
Good morning. Just a question on the vaccination status of the individual. I know the release said he was vaccinated, but had the person received a booster, and/or was he fully vaccinated more than 6 months prior to infection, meaning, when waning immunity could have taken place? So a few more details on the vaccination status would be helpful.
Yes, and this is Jan. I'll certainly ask Kris to chime in if I get anything wrong here. But yes, the primary vaccination was more than 6 months ago, and the individual was boosted in early November.
And if that's it on that, a quick follow-up question. Can you talk about the timing of the investigation? Did this individual reach out to you, or did you find him first through your surveillance and then reach out to him and he cooperated? Just a sequence of that event would be helpful.
Yeah, it's the latter. I think we mentioned on yesterday's call that because of the surveillance program that we have the capability to run positive samples to look for the target S gene dropout, which is sort of a screening method. And we had found some of those cases and had begun outreach to them. And then the laboratory was able to confirm just last night that the sample had the profile of Omicron. So that's my very much layman's description of that. Kris or Dr. Vetter, either one of you want to comment?
I'll let Dr. Vetter start, and then I can just comment on our follow-up.
Yeah, I don't really think, Commissioner Malcolm, you did a great job explaining that. Yeah, the sample came in through our normal surveillance. And yeah, because it was an S gene target failure, we were able to prioritize it and get the turnaround really quick on this one. But had it come through without the S gene target failure, I mean, it would have already been in the queue to get sequenced anyway.
And then our epi team, because of our knowledge that these were specimens that we did have some suspicion about, our epi team was able to do some early outreach back to the individuals to be sort of extra prepared and on top of it when the results came. So kind of a combination. And I think when we've talked about shifting our surveillance and the way we're doing it to be more nimble, this is an example of that, so that we're able to focus on things like this type of case and put our energies there. Over.
Thank you.
The next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is open.
Hi, can you tell us how many specimens your lab is currently evaluating for Omicron?
Are you asking how many kind of suspicious ones we have?
Yeah.
Market dropout. Sarah, can you comment on that?
Yeah, initially it's just a handful, less than 10. But I just kind of want to emphasize that everything, we're still doing a lot of sequencing, and it's important for us to keep our eyes out for the broader surveillance as well. But yeah, we only at this point have a few under like a high priority sequencing.
Okay. And can you talk a little bit about the contact tracing around this patient? I mean, we know that contact tracing has really kind of fallen off in the last few months for a whole host of reasons. Does that look different for this patient and others you might suspect who have it?
Kris, can you take that one, please?
Yep. So, Kat, that's what I was referring to with kind of a shift in our emphasis for our surveillance, is in that this is the type of situation that we do want to be able to do more in-depth follow-up on. And so that's what we are doing. Obviously, this individual had a flight. We're looking at, close contacts. And as the commissioner mentioned, we're working with partners in New York City as well. So yes, there definitely is a high level of follow-up in terms of contacts for this individual.
And have you had to isolate anyone else sort of in his network yet?
Yes, there is someone in the network who has been asked to isolate.
Okay, thank you.
Your next question comes from the line of Jennifer Hoff from Care 11. Your line is open.
Quick follow-up to Catherine's question there. If you have about 10 people that are under surveillance, when do you think you might know in which direction that case might go?
Again, I'm going to turn back to Dr. Vetter, but this is Jan, just reiterating, and CDC is also looking nationally, at these S-gene target dropout cases. So this is a kind of a normal part of the surveillance, but as Sarah has described, we're prioritizing these for faster sequencing, just because of the heightened surveillance around Omicron. But Sarah, what would you say about timelines on any of the ones that we are prioritizing right now?
Yeah, I mean, about half of the ones we were prioritizing were, finished recently. That's in the batch where we found our case. And then the rest, they're actually being done through a commercial laboratory. And we expect those results to be within a matter of days.
Quick follow-up then, since we keep talking about this sort of robust surveillance program, do you think you could just briefly describe, I guess, how it works? I don't know how to best ask, or to ask you to simplify it, just as if we're sort of talking about this program to our viewers, to remind them exactly how it works, why it's something that that you folks keep sort of saying works so well. How can we explain to them how it works? Why is it so great in a succinct way?
Sure, that's a great question, Jennifer, and I'll ask Kris and Sarah to do their best here. It's a fairly complicated process, kind of hard to boil it down to a few points, but we'll give it our best.
Sarah,
Kris, you want to start?
Well, I was going to say, if Sarah wants to start and just talk about the process for the specimens, and then I can just follow up on the epi side.
Yeah, so to start, I think the key to our system is that it's broad, it's vast, but we still have the ability to pivot and focus where we need to. So it's broad in the fact that right now our public health laboratory is asking all of its clinical lab partners from Minnesota who's doing testing to send the public health laboratory a subset of all their positives a week. And so we sequence as much as we can here at the public health laboratory, and then overflow goes to our partner, the University of Minnesota Genomics Center, to do more sequencing. There's also a national sequencing effort happening. So Centers for Disease Control has funded labs to sequence. So one of our partner laboratories in Minnesota, Infinity Biologics, they do a lot of testing for Minnesota, and so they also sequence Minnesota samples through their laboratories. Technically in New Jersey is where the sequencing done, but they also do a lot. And then again, through that national network, there's Quest and LabCorp, any Minnesota samples that get sequenced or get sent to them, it's a little less, it's not all Minnesota samples are sequenced to them, but it's a subset. So through all of those mechanisms, we're sequencing around 2,000 positive samples a week from patients in Minnesota. And so that's a bit, so it's kind of like a big level, small level. But because our public health laboratory, we've developed relationships with Infinity Biologics. We have our partner with UMGC. We have partners with our clinical laboratories. If we hear of something, it's easy for us to get a hold of people and, pull specimens quickly, out of their path, prioritize them, and pivot where we need to.
And then on the epidemiologic side, we are focusing our surveillance and interviewing at this point on, cases in certain sectors, children, high-risk situations, and then when there's a situation like this with a new variant. And so, as information comes in, if we have a situation that's suspect, we can work with the lab and specifically ask that a specimen be sequenced because for an epidemiologic reason we have concerns. But then also, as Sarah indicated, when those specimens are sequenced and identified as being, a particular variant, then our team will do follow-up and look at, interviewing the person, looking at where they were involved, that type of thing. That's why it's particularly important and helpful to us when we do reach out to people that they do respond and, answer the call, because that allows us to do the necessary follow-up. But our goal on the epidemiologic side is to take that laboratory data and say, okay, who has been infected, who potentially is exposed, and what can we do to help mitigate? And so that's what our role is on the epi side.
Thank you very much.
Your next question comes from the line of Jessica Miles from KSTP. Your line is open.
Hi there, thank you. Can you give us any more information about this individual, age, family? Does he have children? Are there children in the home? Anything more on that front?
Jessica, this is Jan. We work really hard to protect individual privacy, so we're not able to release any additional information on the individual, but rather on the sort of the symptoms. We're very grateful that the symptoms were mild and are resolved. Can share things like that with you, but nothing further demographically at this point.
But Commissioner, I'll just add that this individual has been extremely cooperative and has isolated and done all of those things that we would ask someone to do from a public health mitigation standpoint.
Thank you. Is there anything more that you can tell us? I mean, this was leading up to the holiday of Thanksgiving. Is there anything more you can tell us of that, as far as, was this person home then, or were they out and about on the holiday?
I don't know if we have had any information on that at this point that we could share. Kris, I'll leave that to you.
Yeah, I think right. I think the thing we can say and what we've indicated is that the individual, returned from their travel to New York City, and that was before Thanksgiving.
Thank you.
And that they had the test results, I think, on the 24th. That's
correct. Yeah.
Right?
Yeah. And so they were isolating.
Right.
The next question comes from the line of Vineet Nirapil from Washington Post. Your line is open.
Hi, thanks for taking my question. So I'm a national health reporter, and I just got confirmation from the health department that you still believe that Delta variant is primarily responsible for the current surge of hospitalizations. Could Omicron be a factor in the current surge that Minnesota is seeing here? And then do you think the public is paying enough attention to the threat of Delta, which is a bit old news at this point, but we know it's highly transmissible, and it's been spiking very rapidly in the places where it hits?
Thank you very much for that question. Yes, the Minnesota surge at this point is Delta. We know that from our surveillance and sequencing work that it's virtually all Delta in the cases that we've seen to date, and we have been talking a lot lately and hoping that Minnesotans and everyone around the country is really focused on the fact that this pandemic is not over. And that something happens somewhere in the world, and this is a very interconnected world, which is a wonderful thing. But that it just goes to show that a global pandemic is just that, and that we have to all be invested in keeping the rate of case growth down, because that's how these mutations happen. So I think here in Minnesota, we've talked a lot about the extreme strains on our healthcare system, and how that affects everyone's care, not just those with COVID. And so we do hope that this additional news just underscores the urgency of paying attention to the fact that COVID is very much still with us, and that we have the tools to fight back against it, that we know how to mitigate the damage of these surges. And it's time for us to redouble our efforts in that regard, especially getting everyone who's eligible to be vaccinated doing so, and that's the best way to keep this variant or anything else from spreading rapidly, and to get boosters. I mean, I think the booster data, the booster news of CDC's clarification that it's not just a maybe, it's a should, that everyone currently everyone over the age of 18 should get boosted when that time interval comes up. I think all of that is helpful to be really focusing us on those primary tools, but also going back to layered mitigation. I mean, everyone is tired of masking and worrying about social distancing, but it is urgent that we continue to use those prevention measures as well. Thanks for the question.
Thank you.
The next question comes from the line of Abigail Smith from KBJR6, CBS3. Your line is open.
Hi, yeah, I wondered if anyone would be able to talk about the role of monoclonal antibodies in relation to the Omicron variant.
Well, I'm going to ask Dr. Ruth Linfield to take that one. Again, the Omicron variant is so new that there's a lot we don't know yet about the effectiveness of some of these things against Omicron. We expect them to continue to be effective. The question is how effective, and that will become clear in coming weeks. But Dr. Linfield, can you address monoclonals specifically?
Yeah, I don't really have much to add. It is a question that we're all interested in. It is something that I believe these are evaluating, and we will learn more.
Sure. And then I guess I just have one more question. So you're talking about the individual was boosted. Can you talk about how if the booster played a big role in affecting his symptoms? Because I know you said he had mild symptoms. Do you think the booster affected that?
Well, again, I'd invite Kris and Ruth to comment here too, but that has been one of the primary goals of vaccination all along, is certainly to prevent spread, but also very significantly to prevent severe disease and hospitalizations. And it's very encouraging that so far it appears that vaccines are still successful in that regard, even with these few early cases of Omicron around the world. But it's very, very early. But we are certainly, I think it's pretty logical to think that vaccination helped to make symptoms milder here. But Ruth, Kris, what would you add?
No, I would second that there's obviously a lot we need to learn about Omicron going forward, but we're delighted that the initial cases who have had vaccine breakthrough have had mild illness. And as the commissioner said, that really is our goal with vaccination. I mean, certainly if we can prevent infection in the first place, great. But ultimately, our goal with vaccination is to limit hospitalizations and prevent death. And so far, with limited data, that's what we've seen. Over.
Okay, thanks.
The next question comes from the line of Alexander Teen from CBS. Your line is open.
Hi, thanks for taking my question. I'm wondering if you can kind of clarify maybe more details on the timeline of how this played out. It sounds like the positive test you said came back on the 24th. Obviously, we're kind of more than a week since then. So, I mean, how long did it take to sequence it? How long did it take to kind of contact New York and contact the person? Can you just give us a better sense of kind of how that played
out? Kris or Sarah, can you kind of retrace the basic timeline?
I can start with the fact that, you know, once Omicron was identified as a new variant and as an issue, that kind of started the ball rolling. But I guess I should have had Sarah start. So Sarah, you better start because your team got on it when they heard that. And then I can say what our team did.
Sure. So it started, you know, this weekend when, you know, news broke of the Omicron variant, and especially of the news that this variant showed that it had the S gene target failure feature on the TAC-PAS diagnostic assay. And so what we did is, you know, our laboratory looked back at, first of all, any sequences that we've been doing to rule out any Omicron that, you know, that maybe we'd missed, that it hadn't happened. And then we reached out to a laboratory we knew, Infinity Biologics, that was using TAC-PAS, so they could potentially pick up any S gene target failures. And so they looked through their data. They did find some that, you know, that could be sequenced. Again, some had already been sent to their New Jersey lab for sequencing, and then they sent us what they had. And so we received those on Tuesday, actually, and through just an amazing amount of work in our laboratory, we're able to get sequencing results by, you know, late last night.
And then our team, once those potential specimens were identified, then our team started to do some of the background work on the epi side, and started to identify, you know, who these folks were, what we had already learned from some of the initial interviews, and things, so we could prepare to do follow-up investigation once we had more information. I think when you talk about the timeline or ask about the timeline, I think what's significant is that, you know, we've certainly spent a lot of energy talking about identifying cases, and that's important. But I think we need to acknowledge that, for instance, this individual's illness started on November 22nd, which predated, you know, some of the original information about the first identification. So in other words, identifying a case means that we found that cases have been occurring, I think, as has been suggested by other folks describing this Omicron situation. So the timing is that this case, you know, was getting ill even before we were hearing about Omicron from South Africa.
Thank you. That's helpful. And then kind of just to follow up on that, it sounds like then the majority or maybe none of the close contacts have yet been tested positive or negative yet. Is that correct? Or maybe some have been tested positive and negative. Can you just give a sense on where that stands?
There is one close contact of this individual who has tested positive, and there's additional follow-up that's being done. I think one thing to clarify is when Dr. Vetter mentioned that there were a number of specimens that were being tested, they were not linked to each other. They were random, and their commonality was the S gene target failure. So just to clarify that.
And this is with another thing to clarify. I believe Dr. Vetter said it, but this was the only one of the S gene target failures that was positive for Omicron. The others were not Omicron that we ran. There are several samples that are pending, as she indicated. Again, not related to this case.
Your next question comes from the line of Stephanie Becker from CNN. Your line is open.
Thank you. Do we know what type of vaccination the person received? Moderna, Pfizer?
Yes, we do know that.
Care to share?
Well, I think this is Jan. I think we're only hesitating because it's very important that we have all the right permissions to share information before we do so. So, not trying to be cagey, but we follow a pretty careful process of getting consent to release different levels of data.
Okay.
I'm just checking on that, Commissioner, right now.
Oh, good.
I'm just checking on the consent level there. So, yes, I'm sorry, I didn't mean to be cagey.
Okay. Will you just release that when you get it, if we're no longer on this phone call?
Yep, I hope to get it before we're done, but certainly we will do that.
And I was a little confused by something that you just said. One close contact tested of the person who's been identified, or not identified, but the one person we're talking about. But you said one close contact has tested positive, but not for Omicron? I was confused.
One close contact tested positive on a rapid test, and so we have not been able to do further confirmation.
I think. Thank you very much for that, and thank you for this.
Your next question comes from the line of Jill Cohen from New York Times. Your line is open.
Hi there. Can you hear me okay?
Yes, we can.
Oh, sorry. I wasn't sure if I had to do something to unmute. I'm wondering if you can talk a little bit about whether you are considering reimposing or imposing any restrictions. If Omicron does become a dominant strain and not enough people are vaccinated, can you, I guess, just talk a little bit about what kinds of restrictions or mandates you're considering, as we kind of watch this going forward?
This is Commissioner Malcolm. I just would kind of put this in the context of what the president had to say the other day, and I think we'll hear more today. That from his perspective, and I think our governor has said much the same, that we feel like we've got the tools to be able to manage this and respond to it, get ahead of it, stay ahead of it, if we just apply the tools we have. That kind of further regulatory approaches are not on the table at this point. It does not mean they would be permanently ruled out, but if we do the tools in hand and what we know is effective, we should be able to hopefully avoid reimposition of some of those, kind of broader mandates. If people get vaccinated, boosted, and take those other layered precautions, we would prefer that than having to, restrict economic activity or people's ability to live their lives, to live them with care.
And does Minnesota have any statewide restrictions or obviously vaccine mandates aside, because that gets into federal and territories. Are there any statewide mandates in place, like mask mandates?
There are not, as a matter of like emergency orders. We have and will continue to give our best and strong health guidance, which is very much in line with the CDC's guidance, that everyone, regardless of vaccination status, should be masking indoors, given these levels of transmission. And certainly advising, different sectors on best practices to mitigate risk in their environments, whether those are businesses or schools or what have you. But at this point in time, there are no mandates from the statewide level. Some jurisdictions have chosen to do that at a local level. In the schools, for example, CDC recommends, and so do we, universal masking policies in the school. Some school districts have adopted that policy, but that is their local decision at this point.
Thank you.
Your next question comes from the line of Brenda Goodman from WebMD. Your line is open.
Thank you. I have a couple of just sort of fact-checking questions, and I'm sorry, I missed the very top of the call, so maybe you already covered this, but did this individual have any history of international travel at all? And then as a second question, do you happen to know if they took, and can you disclose if they took a rapid test before they took their PCR test and what the results of that were? And finally, do you have any idea how many individuals are being traced as a result of this case, given the conference attendance? And based on the timing of his symptoms, are you able to make an educated guess about whether it was more likely that he contracted the virus at the conference or during travel? Thank you.
Well, thanks for those questions. I think I'm going to turn that over to Kris for the most part. I think just kind of given the timing, as we said at the top of the call, it seems quite possible, perhaps most likely, that the transmission happened at the convention in New York City, but that's not definitive. And that was it was a large convention, and from where all the people came, we don't know. As far as we know, and correct me if I'm wrong, Kris, the Minnesota case did not have any international travel, but it's quite possible that others at that convention maybe did. So that's part of the important work to go on from this point. Kris, anything else?
Yeah, correct. No international travel reported by this individual. This conference is rather large. Some of the estimates we've seen are 53,000 people. So it's a large conference. The individual's symptoms started on November 22nd, and the conference timeframe was prior to that, the 18th or 19th to the 21st. So the symptoms started after attendance at the conference. I'm trying to think, you asked if there was an antigen test first?
Yes.
I don't believe there was, just the one. Oh, yes, it was tested positive. No, it does not appear that there was an antigen test to begin with.
And I'm really sorry, because I know I asked a bunch of questions, but I have one more if you can entertain it. The close contact that's tested positive, is that person in Minnesota or are they in New York?
That is in Minnesota.
Okay, thank you.
Your next question comes from the line of Kris Larson from Flag Family Media. Your line is open.
Thank you, and thank you, Commissioner, and everybody for the call this morning. When we're hearing a lot about, the seriousness of the Omicron variant, what science or data are you guys relying on regarding the variant when you're looking at the seriousness of this?
I'm going to ask Dr. Linfield to take the lead on that question. And as she has already said, this is so new, days, literally, but there's already a lot of investigation going on. Go ahead, Ruth.
Yeah, thank you. So there the group from South Africa has done really an outstanding job of describing the various mutations that have been found in association with this variant. And so people are taking a close look at those mutations and similar mutations that have occurred in other variants and trying to understand on a molecular level whether the mutations are associated with an increase in infectivity and transmission, potentially being able to bind to the receptor site more adeptly, that sort of thing. But what is really important is to also look at what is happening in real life, in looking at people who have been infected with the variant, what is happening clinically, are we seeing any changes in severity? And that sort of data takes a bit of time to come in. When some of the information that South Africa has released, when they identified this, the first cases they were seeing it in were in university students, so a healthy cohort. Fortunately, they were seeing mild infections, people generally presenting with extreme fatigue, body aches, that sort of thing. But we need to see what happens when there is a broader population that gets infected. And so this is early days. I wish we had all the information now that we will in 3 weeks, but this is something that we are all paying attention to and watching closely. Thank you.
A follow-up question, if I could, with regards to the sequencing, the genome sequencing, how long of a process is that start to finish to track down these variants?
Dr. Vetter, you want to take that one?
Sure. Typically in our normal workflow, it can take 4 to 5 days once the sample gets into our laboratory, and that has all to do with, batching and making sure we can get as many sequences done as efficiently as we can. But when we have just a few high priority samples, it is possible to do it within 2 to 3 days.
Thank you.
Your next question comes from the line of Dave Kolpak from Associated Press. Your line is open.
Hello, thank you very much. You had said that you're working closely with you said you're working with your partners in New York. I don't know if you said closely, but I think you did. Can you tell me what you can do on your end to help them with their investigation?
Well, thank you for that question. I think this is Commissioner Malcolm. I'll ask Dr. Linfield and Kris to comment as well. I think that this is just another good example of the value of a strong public health system nationwide and the partnerships that we have to work together on things like this. Obviously, the first cases of Omicron in the nation, again, while totally not a surprise, obviously trigger a lot of interest, and we're all learning together just as quickly as we can here. So, given the circumstances here with the large conference in New York, and the potential, the likelihood that this is and we're already seeing a lot of activity around the country in states looking as we have at recent cases and looking for this screening mechanisms of looking for S gene target failures, pretty technical in the weeds, but just suffice it to say everybody around the country is looking for information and on alert. So the CDC is, of course, the main coordinator of all of us at the state and local level, but I can just tell you there have been multiple calls just in the last 12 hours between the New York folks and CDC and ourselves. So it's very, very early hours, but it will indeed be be close cooperation. Our focus is really on our Minnesota case, and anything that kind of comes associated with that case. But we will absolutely be participating in the national work too. Dr. Linfield, I probably really gave the shortcut there, but what would you add?
I think you articulate beautifully. We work together in public health on these investigations, and we really appreciate the collaboration that occurs between the different jurisdictions and CDC. And similar to other investigations, as Commissioner Malcolm said, we are working closely, and if we didn't say it, I will say it, we are working closely with our New York City colleagues and are grateful for that.
And how difficult, last question, how difficult is it for this case and interviewing him? I mean, can you even attempt to get a handle on close contacts at a convention like this?
Great question. It goes to the challenge of, how the incredible kind of epidemiologic detective work that goes on with these things. But Kris, you want to comment?
Yeah, I was going to say that, we are aware of a circle of contacts for this individual that we are able to follow up with and investigate. But part of the reason that we did indicate where he had been, the anime convention in New York, is because there were so many people that attended that event. And as we said, it would not be possible for him or really for anyone to be able to identify absolutely everyone that they potentially came in contact with. And so that's why it's important that we make people aware that there was, a potential for infectiousness at that event. But as I said, we are doing direct follow-up with the individuals that this person has been able to identify.
Thank you.
Your next question comes from the line of Maricha Jerichu from Newsy. Your line is open.
Yeah, thank you so much. I'm just wondering if you can tell me a little bit more about this close contact. Was the close contact who tested positive fully vaccinated, and did they have symptoms, or did they get tested because he tested positive?
So this is Ruth. I'm just going to jump in and say, we just got this result at 4:30 Central yesterday. We are in the really the beginning of our investigation, and we will be gathering more data. And I know, and I wish we had everything to share with you now, but please understand we're working very hard.
Thanks so much.
Operator, we have time for one more question.
Last question comes from the line of Peter Cox from NPR News. Your line is open.
Yes, I'm wondering if the new variant means people should be thinking any differently about travel plans or holiday gatherings, things like that.
Peter, this is Commissioner Malcolm. I would just say I think it just underscores the importance of what we've been saying for some time in the context of the really persistent Delta surge that Minnesota is dealing with. We're seeing, cases on the increase in additional parts of the country. So even without Omicron, there was plenty of reason for people to take full advantage of those prevention tools, especially vaccination and testing and masking. But no, I think Omicron just again is another kind of wake up call, if we needed another one, that this remains a global challenge that continues to evolve, and that even though we might feel like we're done with the pandemic, it is most certainly not done with us. So yes, I think, just the fact that Omicron has shown up in the world, and it's shown up in our country and in our state, just helps to underscore for people that we still all need to pay attention to this and work together to stay ahead of it, and we can do that.
And that wraps.
And that'll wrap up our coverage of the Minnesota Department of Health press conference with Commissioner Jan Malcolm and infectious disease Kris Ehresmann right here on our social media. Stay tuned for more right here on the social media channels of Flag Family Media.